Welcome to SYCL360. I'm Joe El-Khoury, and this is the 2016 Winter Edition. I would like to start off by saying a big thank you to two SYCL360 members who have completed their term with us in 2015. Drs. Deborah French and Kaylin Olson. From the entire SYCL360 crew, thank you for your outstanding years of service, and we wish you all the best. Highlights. Interview with Dr. Mark Cervinski on working with SYCL and starting a new fellowship program. Interview with Dr. Sharon Ermeyer on her latest book, A Poor Lab's Guide to the Regulations, and A Day in the Life of a Clinical Chemist with Dr. Robert Fitzgerald. Stay tuned till the end to find out who won the draw from the last edition's books and how to win your own copy of Dr. Ermeyer's new book. In this first section is my interview with Dr. Mark Cervinski. Hi, I'm here with Dr. Mark Cervinski, Director of Clinical Chemistry and Point-of-Care Testing at Dartmouth-Hitchcock Medical Center and Assistant Professor of Pathology at Dartmouth, and also the Director of the new Clinical Chemistry Fellowship Program at Dartmouth. Hi, Mark. Thank you for joining me today.
Hey, Joe. Thanks for the invitation.
I wanted to start by asking you, what have you been up to lately?
Well, lately, the big thing that I've been doing is really trying to establish our fledgling Clinical Chemistry Fellowship Program. We have our first fellow on campus now, and she's made great progress already. And it's really been very rewarding to go through and establish the fellowship program and to get that first fellow. It's been busy. It's been a lot of work, but at the same time, it's more rewarding than I thought it would be.
Great. And since you opened up the fellowship subject, how was that experience of setting up the fellowship?
You know, setting up the fellowship, it's a lot of work. It's not really hard work, but it takes time. You really have to look at your facility and look at yourself and figure, am I really going to be able to do this? Do we have the resources in the laboratory, and do you have the personal resources to really work on establishing a program so that you end up with a fellow at the end who can go out and find a job anywhere in the country and be highly employable? So I think it takes a lot of introspection and maybe a little bit of a reality check to say, where are we weak and how can you help build up those areas so that you can beef up the program?
And so what was your motivation with doing this?
For me, it was really career fulfillment. I really view the field as being an excellent place to work and an excellent thing to do. I'm happy every day going to work. And in a way, I really wanted more people to have this opportunity. And for me as well, it's also that I want to give that opportunity, but I also know that there's a lot of times, a lot of things that I'm doing on a daily basis that are great learning opportunities. And I'm just thought to myself, you know, these are things that a fellow could do. They would learn from it, and it would help them get down a career path. And at the same time, it would also help me to have another collaborator, to have someone on site, to have someone to help work on projects. So it was really an idea of having a give and take relationship.
And for those members who are interested in starting their own fellowship program, what advice would you give them, since now you've been through this, and what advice would you actually give yourself, knowing now what you know about the process?
Yeah, I would say you have to start early. It takes a long time. Doing the self-study takes a long time itself. But then you also have to realize that there's a number of commissioners in the COMAC program, the COMAC commissioners, who have to review your self-study, give you feedback. They have to schedule the on-site visit. So it's going to take a long time to get this all done. The other thing I would say, going back, knowing what I know now, what I really wish I would have done was reached out to other programs, especially programs that had just recently had an inspection or recently just been established, and find out what feedback they got from the commissioners, and also to talk with those programs that are really successful. You know, what things make your program different? What things make your program stronger? And see if I can incorporate those into the program that we had. So we had some feedback from the commissioners, and we're building those areas up now so that the next time we have an inspection, I hope it goes well, or as well as the last one. But yeah, so a little bit of hindsight would have probably told me to reach out to more program directors just to ask them for advice.
That's great advice itself. So let me ask you now, switching gears to recently you actually gave one of the SYCL workshop seminars in the 2015 meeting in Atlanta. So I wanted to ask you, how did you get involved with that?
Well, with the SYCL workshop and giving a lecture, the way I got involved with that is just over the last 6 years, or actually even longer, just becoming involved with different SYCL activities, volunteering for different SYCL activities, and just being available to volunteer and follow through with those volunteer steps. That over time, you get to be known as someone who's going to reliably do the work that's asked. And I think that you become essentially your successes build on successes. Your volunteering builds on volunteering. And specifically for the talk, it was just something that I think that we do very well at the facility I'm at. I'm very fortunate to have a very active chemistry and supervisor who is also willing to try new things and to push the envelope. So because of that, we had some experience that we thought would be really good to share with the SYCL workshop.
And for members who are interested in getting involved in SYCL in general, do you have any advice for them?
Let people in the SYCL committee know that you're interested in being a volunteer. If you get an opportunity to volunteer, and it's something you truly can do, and it's something you have time to do, say yes, complete it to the best of your abilities, and that's going to be noticed. And I think that's the same thing with anything with the AACC. AACC is really successful because of the volunteer efforts of our members. And if it's not SYCL, maybe it's AMOC. You want to be part of the AMOC in a few years? Let it be known to people who are on AMOC. And it'll take a while, but little successes and volunteering will lead to bigger successes.
All right. Well, thank you very much, Mark, for answering all my questions. And again, for all SYCL members, get involved, reach out to SYCL. Mark is one of them, so you can email him or always contact the chair, Shannon Heyman, always available for us. So thank you very much, and thank you, Mark.
Well, thank you, Joe.
Next is Dr. Brenda Suleylem's interview with Dr. Sharon Ermeyer on A Poor Lab's Guide to the Regulations.
Today, we will review the 2015 edition, The New Poor Lab's Guide to the Regulations, described as a compliance and inspection survival advice for CLIA, the Joint Commission, CAP, and COA, successful strategies and specific applications of the regulations. I am joined today by the author of this book, Dr. Sharon Ermeyer, Professor Emeritus of Pathology and Laboratory Medicine at the University of Wisconsin in Madison, Wisconsin. Hi, Sharon.
Well, hi, Brenda, and thanks for giving me this opportunity to discuss one of my favorite topics.
We're really happy to have you. So, to get started, what is included in this book and how will it benefit the reader?
Okay. Well, I'm assuming that most people, or I'm hoping that a lot of people have the guide, but I know that that's probably not the case. And Brenda has been so kind that she has prepared some slides to go along with my answers. So if you look at these slides, you'll see the table of contents, and it starts out with an overview of the regulations. Now, I was telling Brenda that this is the 2015 version that we're looking at today. Actually, the guide, it's been under slightly different names, has been in existence since probably the late 1990s. And it originally was written or co-authored with my mentor and friend and the director of the Wisconsin State Laboratory of Hygiene. And unfortunately, he is no longer with us. And so I know that he really wanted me to continue on, and that's exactly what I have done. So we start out with the regulations and overview because, let's face it, we have a lot of things to do in the laboratory, and sometimes just knowing the nitty-gritty of the regulations slips through our fingers. So we focus on CLIA, the Clinical Laboratory Improvement Amendments, because CMS with the CLIA regulations really establishes the minimum requirements for laboratories involved in testing that is used for the monitoring, treatment, and diagnosis of disease. It goes on and includes the big components of CLIA. So there's a chapter on proficiency testing and procedure manuals and method verification, including calibration and calibration verification. A big section on quality control, another chapter on quality assurance or assessment, a look at personnel and all of the different categories for moderate and high complexity testing. There's a chapter on preparing for inspection. And then more recently, I added a chapter on point of care testing. Now, CLIA really doesn't focus on point of care testing, but as we know, point of care testing has become very popular. So I thought it was really important to include that as well. So that's what's here in the book. Who will benefit from it? Well, anybody that really is unsure or needs to know what is really required for regulatory purposes in providing quality test results.
So why did you decide to write on this subject?
Well, there was a real need. Now, Dr. Lessig, being the director of the Wisconsin State Laboratory of Hygiene, really was always in the throes of the regulatory picture for the laboratory. And he felt a real obligation to help people, not only in Wisconsin, and when I say people, I really mean laboratorians, not only in Wisconsin, but really all over the U.S., meet the regulations. And at that time, I had just obtained my PhD, and he was my chief mentor, and we would put together a lot of workshops to help people out. And we didn't have a guide, but we had, pieces of paper stapled together that the workshop participants could take home with them to try to put into practice what we talked about. And so this need or these requests for education workshops just grew and grew and grew. And matter of fact, I can't tell you how many years we gave half-day and full-day workshop at the AACC national conventions over the years. So what we did then is that we compiled all of these pieces of paper and organized them more and augmented them so that it actually could become a guide.
Oh, wow. So if someone were to acquire this book, what advice would you have for them on how to use it?
Well, I think, unlike a novel, I don't think you have to read it from front to back. You should start where you need some help. If you are a little confused about, say, calibration verification, start there. Or if you want to really get a handle on the personnel that is needed for regulatory purposes, well, then look into that chapter. So use it as kind of a need be, on a need be basis. And matter of fact, the way it is bound, it's not, bound like a book that where you try to keep a book open and you just can't. This is spiral bound so that if you really want to put it flat on the lab counter, you can and work directly out of it. So I'm hoping, our intent certainly was to make it very user-friendly.
So what message should readers take away from the new Poor Labs Guide to the Regulations?
Well, the message that I would like to have them take away is that they should think of this guide as a tool. And we want it to be very understandable. And in so many ways, while it's written for big laboratories, medium laboratories, and small laboratories, we really focused more on the medium to small, assuming that the larger laboratories have the good leadership and the right mix of people, and maybe higher staff that has been with advanced degrees, particularly in laboratory medicine, and so they do know how to get the job done. So this is not a sophisticated read that you're going to have to read something over and over and over again. And I think we've all experienced that with various textbooks. It is really just the nuts and bolts of getting down to the core concepts. And our focus really, to some extent, was more on the moderate to smaller laboratories that, these laboratories probably need more help. That's a real generalized statement, but that's where we thought we could be the most helpful. So I think they should say, hey, this is a tool that we can look at and get some good information. And then also for laboratories that feel that they're doing the right thing, or maybe they're not quite so sure they're doing the right thing, they can use this tool to really validate that, yes, we are doing the right thing.
Sharon, thank you very much for taking the time to discuss the new Poor Labs Guide to the Regulations with us today. It's definitely been a very informative discussion.
Well, listen, Brenda, as I said, hey, thanks for giving me the opportunity to talk about one aspect of my life, educating laboratorians.
In this next section, Dr. Robert Fitzgerald was kind enough to let us follow him around the lab thanks to a GoPro he carried and allowed us to take a glimpse into his daily routine as a clinical chemist at the University of California, San Diego Health System. Special thanks to Dr. Jane Yang for preparing and editing this section.
Welcome to Day in the Life of a Clinical Chemist. Time to head to work. As you can see, flash ride. Pretty quick. Got lots of gears. In fact, is environmentally green. 7:22. Time for a surf check. Small, but gorgeous day. So, beginning of the day, you can see how much respect I get around here. Here we go. Good morning, Roy. Nice to see you.
How can I help you today, sir?
Oh, nice to see you too, Roy. It's really great to get some respect around here.
Let Roy help you, sir. You work so hard, doctor. Keep up the great work.
Thank you, Roy. I appreciate that. I need all the support I can get, buddy. As you can see, happy lab staff, treat me really well. It's a joy to come to work. So what are you doing, Breland?
Well, today I'm looking up some reference materials to purchase from Cerulean
Because?
because we want to check on the cross-reactivity of epinephrine and its metabolites in the immunoassay for amphetamine drugs.
One of the things that I do is work with the fellows on a variety of things. They interact with clinicians in a variety of different cases, from toxicology to endocrinology. An example of one of our fellows was interacting with our endocrinologist. So Amir, could you just tell us briefly what was going on?
So we have a case of unknown thyroid disease, and the endocrinologist wanted some help interpreting some immunoassay data. So they're confused and they're concerned whether human anti-mouse antibodies could be giving us a false result for either the TSH or the T4 assay, the free T4 assay.
Trying to keep up with emails always a struggle. Every time you turn around, you got another 30 messages. So that requires a fair amount of time, but it is a good way to stay in contact. I think one of the responsibilities of clinical chemists is to be a spokesperson for laboratory medicine. And recently I got a phone call from a Wall Street Journal reporter asking me what a condition level deficiency was, which is the most severe citation that CMS gives. And at first I was a little bit hesitant to talk to him, but I thought that it was important. So without knowing what lab it was, I gave him my impression about what a condition level deficiency was. And it ended up showing up in the Wall Street Journal, which I think is a responsibility for us to stand up for good laboratory practices. And this sort of shows you what it was about, along with my quote. So one of the things we do is we have stand-up meetings. They're an effective way to do quick communications. This is the toxicology stand-up. We have staff here.
Josh, Krista, Dr. Stone, fellows Breland, Jane, Amir, and our initial employee, Heather.
We have a quick agenda. It's a quick touch base. Now find out what's going on in the lab and make adjustments from there. So one of the other things that I do is we do fellows conference, which we focus on clinical chemistry issues, and we have Dr. Pesci here today, and he's a common contributor to this conference.
You've seen the other fellows. Dr. Lowenthal is a chemistry resident.
So it was a 47-year-old female, and she had she had breast cancer, stage 3, treated currently on aromatase inhibitors, which is an anti-estrogen, and she had bone-specific alkaline phosphatase elevation. And the clinician wanted to know, is this bone mets or is this something else going on, liver involvement? And so we explained to her to do some other liver testing as well as CT scan, which all came back normal. So,
and as it turns out, it gets
elevated by up to 20% due to the specific medication aromatase inhibitors class.
This is the fellows residence conference room. They're sort of not really a conference room, but their office. So we were talking about pyelonephritis. Mm-hmm. And as always, the inevitable voicemail.
Hi, Dr. Fitzgerald. This is Dr. I'm one of the family medicine docs here at UCSD. I had started ordering some Utoxes for patients on different medications, and saw your name there as a resource for interpretation. I guess my specific question is, I've got patients on various stimulants for ADHD, and some of them seem to be coming back positive for amphetamine, which I would expect and some of them aren't coming back positive for amphetamine, which I would not expect. And so I'm not sure if this is maybe just differences in medications, or if there's any reliability in interpreting those with negative results as possibly not taking their medication. So if you could let me know, that would be great. Probably the easiest way would be through EPIC.
One of the things that I do is I teach a lab medicine class to the second-year PharmD students, and it's actually a great chance for them to learn how to use a laboratory to see if their drugs are working or not. And so this is the class, and their general impression about lab medicine is This is a academic senate meeting, just one of the things that I do on campus.
So once again, welcome to our February 2016 Representative Assembly meeting and Town Hall on the changes in the retirement system that are being proposed.
Always super exciting. So one of the things we do as clinical chemists is develop new techniques, communicate new developments in the laboratory. So I spend time with staff doing those kinds of things. And so we are currently working. Krista, what are you doing?
I'm presenting part of my presentation that I'll be doing at MSACL. I'm going to do a presentation on what we're calling vendor software rule systems, basically how when you're actually doing data review, you can do it manually, you can pay some money and do full automation, or you can kind of take the middle road and do a semi-automated workflow.
A lot of this is driven by Dr. Stone, who is done a lot of these kinds of things. Sort of leads our effort in interfacing and data analysis, as well as any thoughts, Judy?
Just that we're talking about how you would come up with criteria for accepting whether data is good or not, and now we have luckily some consensus guidelines about it, the C62, so I'm trying to find what we want in there.
It doesn't get better than that ending for your day. And now for the part everyone's been waiting for, the book raffle. Now I'm going to draw two winners from this cup over here. Not a lot of participants. But hey, we're just starting, so that's a good start. The first will receive a signed copy of Body Fluid Testing by Dr. Darcy Block and Dina Frank. And the second will receive a signed copy from Dr. Alan Wu's book, Performance Enhancing Drugs and Adulterants. Now, for the first winner, just gonna do this real quick. And the first winner is, still got it, Rajivan Selvaratnam. And I apologized if I mispronounced the name. So, Rajivan, I will be contacting you to mail your signed copy. That's Body Fluid Testing. And the second winner is Mahashima Na. So Mahashima as well, I will be contacting you. Congratulations to the winners, who will be contacted via email to have the books mailed directly to them, as long as they reside in the United States. And to enter into the next raffle for a chance to win a Poor Labs Guide to the Regulations, like and comment on this video in the AACC Artery thread by May 1st, 2016. This is also your chance to let us know how we're doing. So please comment about this edition, and as always, we would love to get your feedback. Finally, I leave you with this bonus clip, again from San Diego and courtesy of Rob, so you can relax and get over your winter blues. Thank you for watching.